Smile by Lily Allen, because we're talking smiles today. So hopefully on the end of the line, I've sorted myself at this end as well. It's Dr Ben Atkins. Ben, are you there?
Good morning. How are you?
I'm fine, thank you. Apologies for all our technical issues. Thank you for staying with us. Lovely to talk to you. So we have become more aware of our smiles, haven't we? Of our physical appearance generally, because of how we look on Zoom. I think what it's made me realise is how much actually face-to-face contact helps you connect with people. It's much harder through a camera.
Do you know what? It's so difficult because you also see yourself in the top right-hand corner, don't you, whilst you're chatting away? And I think my patients have become this aware of their smiles, which for me, as a dentist, I've got to use that to get that preventative journey really embedded, because oral health is something we can really control ourselves. And the work the Oral Health Foundation have done with Invisalign to understand what people are feeling means that I can understand what my patients want and need, and it's brilliant. The stats are fantastic.
Now, I must say, I've had Invisalign myself, so I know what difference it makes. But a good smile, it really helps connect, doesn't it? It can put somebody at their ease straight away. It says so much about you.
It really does, because my patients, like yourself, who will come into the surgery, they'll sometimes not know. And what's highlighted in this journey of this COVID, wearing masks and that sort of thing, is you walk down the street, you'll see someone you know, you're on your phone, you usually would smile, wouldn't you? You just smile, and that knowledge that you haven't done that has made people think about their teeth, think about that journey. And a lot of patients, like yourself, are going through that aligning their teeth journey.
And I suppose we've not had dental checkups and all of that, visits to the hygienist, which I always dread, but I know they're essential, during lockdown. And I just made an appointment with my hygienist the other day, but I did kind of brace myself while I was doing it, because I thought there's a lot to catch up on there. And I guess that's putting a lot of people off, thinking, well, I'm so far behind now. Is it going to be awful when I go back?
I really understand that mentality. But like you say, you've picked the phone up and spoken to your practice. It's surprising to me how quickly everyone's come back. And because dental practices have been open during lockdown, a lot of patients have been wanting to see us. They've wanted to think, I can go and do that. But secretly, some patients actually think it's a treat to come out to see us because they've been able to go out, you know? You do, I mean, I laugh, but yes. But realistically, understanding that smile, understanding who we are, is absolutely amazing. And that experience of coming to the hygienist or therapist to get their teeth cleaned is a treat these days, quite frankly, because you can walk out with a beaming smile, and it sounds like that feeling when you having your hair cut, you've got it all nice and tight, it's all cut really short, you get that lift. It's exactly the same when you get your teeth cleaned, because you don't realise you're not smiling, but then you realise it's because of the stains on your teeth. So it's the same effect with the Invisalign journey as well, and it makes such a difference to my patients and confidence really wise.
And what makes a good smile, Ben? Who has a good smile? Give me a celebrity that you think, oh yeah, that's a smile to die for.
Do you know what? It's that Cameron Diaz smile or the Tom Cruise smile, that sort of journey where you can feel they've got confidence. It's that people that exude that journey. And do you know what? It doesn't matter. It's a smile, often with their eyes as well. You know, their smile, we all know that person that lights up the room when they smile at you. You know, my little girl, my wife, the family makes such a difference to me. When you get home from work and someone smiles at you because they've got confidence, because they've got that smiling, it really makes such a difference to your day.
And it needs to be a smile for the whole face. Now, and we will be wearing face masks in certain places for a little bit longer. So it needs to be a smile that reaches your eyes. The mouth is important, but it's about the whole face.
It really does. And a really good, confident smile makes your ears smile. You know, it's that it goes across your whole face. And having confidence with your patients, especially with the preventative journey, making sure that what you've got is preserved. We've all been through this horrific journey, but let's use the smile to get people's confidence back in something we can control. Brush your teeth twice a day with a fluoride toothpaste. Something you can control. Look at them in the mirror. Is anything bleeding, anything going wrong? You can tell. Visit your dentist as often as we recommend. Give us a phone call. We're open. We've not been shut. It's fantastic. And let's get rid of those sugary snacks that we've all succumbed to a little bit.
It must be quite nice for you, Ben, isn't it, that people are pleased to see you? because, you know, it's a bit of a...
Seen me now. I'm joking. It really is. It's been a refreshing change when a patient walks through the door saying, "Hiya, you're the first person I've seen in 6 months." We're on to a good start then.
So the message from you is make that appointment. It's probably not going to be as bad as you think it is, and in the long term, it's going to benefit you.
Do you know what? Come to see us. We'll make you smile again, and it's really, really important to do that, especially at the moment.
Thank you, Ben. Lovely to talk to you. Thank you so much for sticking with us through the technical issues, and I wish you a smiling goodbye.
Fantastic. See you later. Keep smiling.
Bye.